Aspirin, used in the prevention of heart attacks, is probably the most cost-effective drug available in medical practice, and a daily low-dose aspirin is now a standard item in the management of heart disease patients. There is evidence that aspirin taken during a heart attack can reduce the size of the clot causing the heart attack and may even cause the platelets in the clot to disperse. Research shows that the death rate can be reduced by 20 to 25%. Aspirin also has effects on processes other than clotting, suggesting that if it's taken very early in a heart attack, the damage to the heart could be reduced and additional lives saved. Patients with a known risk of heart attacks, including all people over the age of 50, will be well advised to carry a few tablets of aspirin at all times and chew and swallow the tablet immediately if they experience severe chest pain, even as they are phoning the 999. They are chewed rather than swallowed, as this means that they are absorbed twice as fast into the bloodstream, speeding up the treatment. Soluble aspirin should not be swallowed whole. Although aspirin will greatly benefit the patient, we cannot force them to take it. Instead, we can offer it to them and tell them it could help them. In the workplace, the HSE accept that this is a valid time to offer medications to a patient. The problem can be carrying a packet of aspirin. It could be difficult to carry, the tablets can get damaged or damp. If they get damaged or damp, this will render them useless. There is a solution to this. This is a product called the Aspod. The Aspod is a small keyring that holds the aspirin safely inside. They're protected by foam pads and the case closes to hold them safe. The Aspod glows in the dark and you can add text to the strap. Aspods are not expensive and you can buy the Aspod from our store or at the bottom of any one of our websites. Giving aspirin to a patient still means you need to call the emergency services, as you're still dealing with a serious medical condition. If you suspect you're dealing with a patient having a heart attack, you must make sure that we call the emergency medical services straight away.